our bath routine normally involves, making sure we wash, we knew that, and then putting moisturizers on, but also putting on hydrocortisone. And there's this constant argument between me and my husband around it's good, it's bad, don't put it on the eyes. What do steroids do for eczema, and how do we manage that?
Yeah. So back to my brick wall.
It's such a good analogy.
So once we've got this inflammation or these flares, it's helpful to think of them as a fire, okay? And our steroid medications are what puts the fire out. So we know our moisturizers help deal with the fact that we don't have enough of the cement type stuff to hold in water. But what our steroids do, they deal with this inflammation, these flares as they come up.
Yep.
And so if you're thinking of it as a fire, we want to use our steroids early into a fire. We don't want to wait until a fire is really bad. It's really hard to treat when it's out of control.
Yeah.
So I'd recommend getting your child out of the bath or shower. Perfect time to use steroids in the first few minutes after a bath or shower. And we only need them once a day, so that's the perfect time. Looking over the child's skin, anything that is slightly pink, red or raised, that looks like an early flare or an existing flare, or in darker skin, it might be dark, rough patches.
Yep.
They're what we're going to treat with the steroids, and we want to make sure that we're using a good shiny layer of them. So sometimes we use the word sparingly, but sparingly is not a helpful word because it doesn't really give you a quantity to use. We want to use a nice shiny layer to cover the amount of the to cover the area of flare. And we also have different types of strengths of steroids. So you mentioned hydrocortisone.
Yes.
So we've got 3 categories in New Zealand and for what we use for children, 4 generally. And we've got our mild, which is your hydrocortisone, your 1% hydrocortisone.
Okay, there is a 0.5 as well. Hey?
Yeah, we often
really
don't
do
use that anymore.
No.
So 1% is generally all we use. We
Yeah.
don't go any lower than that.
Okay.
There's kind of not a difference in using them, in all honesty. So we use 1% as our mild and our lowest. That can be really helpful if you've got mild eczema or eczema that's presenting for its first time. So, and especially to faces. So we use lower strength for faces and necks and underarms and groin areas.
So the 1% is fine on the face?
Yep.
Okay.
Yeah, so we use the mild as our hydrocortisone. Then we have our moderates, and so they tend to be our Ristocorts or our Umovates. And so they're our moderate strength. They're often helpful for body eczema. Sometimes we will use our moderate strength for severe facial eczema. And then we've got our potents, which are most commonly used sort of in our preschool and older age groups. So they are our Advantins, our Betas, our Alicons, and our Locoids. And so it depends on your child's eczema as to what you need. So the right steroid is the lowest strength that's effective. So there's no point in using a hydrocortisone on a severe body eczema for a long period of time if we're not putting that fire out, because we're getting steroid exposure without any of the gains. We're not actually getting symptom management. So the right steroid should clear the inflammation. It should be completely clear. We roughly say within 2 weeks. So 2 weeks is a good guide.
Okay.
If you're doing all the other things, you're bathing, your bleach baths, you're moisturizing, your steroids should be working effectively in that time frame. If at 2 weeks you've used them every day and we're not seeing resolution of flares, something in the management's not right, or it's not the right steroid. So we need to choose the right strength that's effective. We also sometimes need to change around with the preparation. So steroids come in creams and they also come in ointments.
Yes.
And so creams are really helpful if you have widespread areas or if the skin is kind of weepy, so where watery stuff comes out. Whereas ointments are more helpful if the skin is broken, because sometimes it can sting, and we definitely can still use steroids in broken skin. So ointments can be helpful for that. Or if the skin's what we call lichenified, so it becomes really thickened and dry, that's where ointments can be really helpful. So it depends on the right strength, the right formulation, and either way we want to start early into the flare and every day until that fire is out and stop, and restart when it comes back. Sometimes we'll see it comes back really quick, and if that's the case, then often we teach families to taper with steroids. So use daily and then every second day for a wee while before stopping, just to slowly taper that steroid.
What's the reason you say that to families, to taper
So
off?
if you think of that fire analogy, so sometimes we will use steroids and we'll think, oh, it's gone, it looks great, that fire's out. But if we looked at microscopic level, there's little sparks there. So there are a couple of
the embers.
scratches. Yeah. So then, they have a rough night and they have a bit of a scratch and you're back at square one.
Oh, wow.
So
That's a
by
good
doing the
explanation.
tapering is almost putting that fire out and then almost just putting a bucket of water on it every second day just to make sure those sparks aren't there, and then that the flame's not coming back. So
Such a good explanation. Oh my gosh, so
Yeah,
good.
yeah.
I did not understand that, and that will solve a lot of arguments in our house around what to use, when to use.
yeah,
So to summarize then how we should understand treatment, it's the creams and the bleach baths and the moisturizing is the continuous preparation, and the hydrocortisones and steroids that we know of that we can get over the counter, because you can get some of them without a script, I think. Those are only for putting out the fires when you see a big like flare up and it's really causing grief and itchiness. That's a good summarization.
Yeah, so when we can get some over the counter, hydrocortisone 1% is all you can get over the counter.
Yes,
the
I
rest
think
must
so.
be prescribed. But we just want to make sure, so that's all correct. Daily bathing, 10 to 15 minutes, warm water. Bleach baths if you can. Moisturizer as often you need to keep the skin nice and moist. Scooping it out and smoothing it down in a downward motion. And then using our steroids as our buckets of water to put our fire, those inflammations out, and making sure we're starting early into a flare and every day until it's gone.
Yeah.
And if it's coming back quick, then we need to do some tapering. And there are some really great, if you go to your GP, ask for a management plan. They've got access to print off these management plans. And if we are going to taper and recommend a family slowly tapers off steroids, we have little tables which help to do that. So most of the time we can get, if it's mild to moderate eczema, we can get away with just using a shiny layer until it's gone. And then it might come back, but there'll be a period where it doesn't. But if it's coming back quick, or it's a chronic area that always is the same area, then tapering can be helpful.
That's really good. I don't think that stuff existed a few years ago, so that's really good that's in place now. So awesome.